Have you ever had a strange, lingering headache that just wouldn't go away? Or felt unusually tired, even after a full night's sleep? What if I told you that those subtle changes could be your brain's quiet cry for help? An early warning that something serious is about to happen. Today, I want to tell you a true story. A 65-year-old woman once said, "I just thought I was stressed. I didn't realize my blurred vision and fatigue were signs of something worse." 1 week later, she had a stroke. And the truth is, she's not alone. Every year, more than 795,000 Americans suffer from a stroke. Many of them had warning signs. But the signs weren't dramatic. They didn't fall over. They didn't lose consciousness. Instead, the signals came quietly. A tired body, a foggy mind, a sudden moment of confusion. The real tragedy? Most people don't notice these signs until it's too late. But you're not going to be one of them. This video isn't about scaring you. It's about preparing you. We'll explore 7 signs that may appear up to a month before a stroke happens, and how to recognize them before it's too late. Because instead of waiting for a crisis, you can act early, get checked, and possibly avoid becoming one more number in a grim statistic. Think of this as a roadmap to protect your future health, to keep you walking, talking, thinking, and living fully, without interruption. So, if you've ever felt off and couldn't explain why, stay with me. What you learn today could save your life, or someone you love. Let's ask an honest question. When was the last time you truly thought about your brain? Most of us don't. We focus on our hearts, our joints, our blood sugar. But the brain? We only think about it when something goes wrong. The truth is, a stroke doesn't wait for a convenient time. It doesn't care if you're still working, caring for grandkids, or planning your retirement trip. It strikes, fast and hard. But here's what many people don't realize. In many cases, your body gives you warnings, not just minutes before, not even just hours before, but days or even weeks in advance. The warning signs aren't always dramatic. Sometimes they show up as nothing more than fatigue, a moment of dizziness, or a sudden slip of memory. That's why people ignore them. They think, "I'm just getting older," or "I didn't sleep well last night." But instead of brushing it off, what if we paused? What if we said, "This feels different. This doesn't feel right"? You see, strokes are not random. They're often the result of silent conditions building up over time, things like high blood pressure, cholesterol, or atrial fibrillation. And yes, even if you're young at heart, physically active, and feel mostly fine, the risk is still real. So why does it matter to recognize the signs early? Because the earlier you act, the more of your brain you can protect. Because instead of waking up in a hospital bed unable to speak or walk, you could be sitting in your doctor's office, catching a problem before it escalates. Instead of months of rehab, you might need only a change in medication or diet. Instead of losing your independence, you stay in control. It's not just about living longer, it's about living better. So let's walk through these 7 signs one by one. Let's understand them. Let's make sure you can recognize them in yourself or someone close to you. Because awareness, not fear, is what gives us power. Let's start with a symptom that's easy to ignore: fatigue. Now, everyone feels tired from time to time. Maybe you didn't sleep well. Maybe you've had a busy week. That kind of tiredness makes sense. But what if you feel tired in a way that's different? What if you wake up tired, go through the day tired, and feel like no amount of rest can help? That kind of exhaustion, deep, persistent, and unexplained, could be your body telling you something isn't right. In the weeks before a stroke, some people describe feeling drained for no clear reason. Not just sleepy, but slowed down, mentally foggy, struggling to focus, as if the body is trying to move through heavy water. Why does this happen? Sometimes it's because blood flow to certain parts of the brain is already being reduced, due to narrowing arteries or tiny clots forming. This low-level interruption might not cause dramatic symptoms yet, but it creates a silent strain on your brain. Instead of brushing it off, ask yourself, is this fatigue different from what I'm used to? Because rather than thinking, I'll just push through, what you might really need is a checkup, a simple test, a second opinion. Recognizing this early could mean preventing a stroke before it ever happens. Most of us have had headaches before, a little tension, a bit of stress, maybe too much coffee or too little water. But what if the pain feels different? What if a headache appears out of nowhere, lingers for days, and just won't let go? Doctors call it a sentinel headache, a type of warning signal that can show up days or even weeks before a major stroke, especially a hemorrhagic one. This headache isn't always sharp. It might be dull, pressure-like, or it could feel like a wave that comes and goes. But here's the key. It feels unusual for you. One woman described it as a shadow pressing behind my eye. It didn't hurt badly, but it never left. She had a minor brain aneurysm that ruptured 2 weeks later. Why does this matter? Because instead of assuming it's just stress, you can choose to investigate. Instead of waiting it out, you can speak up and say, "This isn't normal for me." Your brain doesn't have pain sensors like your skin does. So when it does create pain, especially persistent or sudden onset headaches, it's worth paying attention to. A new, unexplained headache is not something to ignore, especially if it keeps visiting uninvited. Rather than popping another painkiller, maybe it's time to pick up the phone. That simple choice could buy you time and protect your brain from something far worse. Have you ever looked up and suddenly noticed the world seemed blurry? Maybe your vision went double for a moment. Or one eye just didn't seem to focus right. It's easy to think, I just need new glasses. Or maybe I'm tired. But what if that moment wasn't about your eyes at all? What if it was your brain calling for help? When blood flow to the brain becomes restricted, especially in the areas that process vision, it can lead to sudden and unexplained changes in sight. Some people see flashes, others see shadows or partial blindness, and sometimes the vision fades in one eye, like a curtain being pulled down. These changes might last only a few seconds, or several minutes. They might go away completely. And that's what makes them dangerous. Because instead of thinking, that was strange, I should check it out, most people go back to their day, not realizing what just happened could have been a transient ischemic attack. A mini-stroke. Your vision is not just about your eyes. It's a direct extension of your brain. And any sudden disturbance deserves attention. So the next time your sight shifts without warning, don't just blink it away. Don't wait until it happens again. A quick eye exam won't find the cause. But a visit to your doctor just might reveal what's really going on behind the scenes. And instead of missing your chance, you'll be one step ahead, protecting not just your sight, but your future. Have you ever opened your mouth to speak, and the words just didn't come out right? Maybe you meant to say something simple, but it came out slurred. Or maybe you knew exactly what you wanted to say, but the sentence just wouldn't form. Worse yet, you hear someone talking to you, but their words don't seem to make sense anymore. It's like your brain is stuck in fog. These are not signs of just getting older. They could be early signs of a stroke, or more precisely, a mini-stroke, also known as a TIA. What's dangerous is that these episodes often last just a few minutes. They clear up on their own. You might feel fine afterwards, and that's exactly why people ignore them. But instead of thinking, "I'm okay now, so I don't need to worry," imagine this. What if that moment was your brain's dress rehearsal for something much bigger? Speech is a complex function. It involves multiple areas of the brain working in perfect harmony. So when your speech falters, even briefly, it's not just a slip, it's a sign. Instead of waiting for a full-blown stroke to take your voice, your words, or your understanding of the world, what if you took that early glitch seriously? One call to your doctor, one scan, one moment of caution. That's all it might take to stay one step ahead and protect your mind, your independence, and your ability to connect with the people you love. Picture this. You wake up in the morning and one side of your face feels heavy. Or maybe your arm or leg doesn't respond the way it usually does. It's harder to hold your coffee cup. You feel a strange numbness in your fingertips. Do you shake it off and think, "Maybe I just slept wrong"? Many people do. But here's the truth. Sudden weakness or numbness on one side of the body is one of the clearest signs that your brain is in distress. It might be temporary. It might go away in an hour. But that doesn't make it harmless. Instead of assuming it's a pinched nerve or bad posture, ask yourself, why is this happening out of nowhere? Because a stroke, or a transient ischemic attack, often affects one side of the brain, and each side controls the opposite side of the body. So if the left side of your brain is struggling, you might lose feeling in your right arm. If it's the right side, your left leg might drag. This isn't about minor discomfort. It's your nervous system waving a red flag. Rather than waiting to see if it improves, you could make one simple choice. Call someone. Get to a doctor. Ask for a scan. Because instead of months of rehab to relearn how to move, hold, or walk, you might stop the stroke before it even begins. And isn't that a trade you'd rather make? Have you ever stood up and suddenly felt like the room was spinning? Maybe you lost your balance. Maybe your stomach turned. Maybe your legs felt shaky, like the floor wasn't solid anymore. Now, it's easy to blame dizziness on low blood sugar, dehydration, or even a simple inner ear issue. And sometimes, that's all it is. But what if it's not? What if that sudden wave of nausea and unsteadiness is more than a passing moment? Many strokes, especially those that affect the cerebellum, the part of your brain responsible for balance, don't show up with the classic signs like facial drooping or speech problems. Instead, they hit you with disorientation, vertigo, vomiting, a deep sense that something is wrong. One woman said, "I thought it was an ear infection, but it was a stroke hidden behind my skull." Her CAT scan came back normal. It took an MRI to finally detect it. That's the risk. Instead of waiting for obvious symptoms, these subtle signs might be your only chance to catch the storm before it breaks. Rather than lying down and hoping the feeling passes, you can stand up for your health. Call your doctor. Ask for better tests. Because if it is your brain sending a signal, you won't want to miss it. You might be dizzy for a day, Or you might be catching something that would have changed your life forever. Sometimes, the most important signal doesn't come from your body. It comes from within. Have you ever had that quiet voice inside you say, "Something's not right"? You can't explain it. Nothing hurts. There's no clear symptom. But you just don't feel like yourself. Maybe your thoughts are slower. Maybe your mood has shifted. Maybe you just feel off, and you don't know why. This vague but powerful feeling has been described by many stroke survivors. They couldn't point to one thing, yet they knew something was wrong. Their energy felt strange. Their coordination wasn't the same. Even their handwriting changed slightly. It wasn't dramatic, but it was different. Instead of ignoring that internal alarm, what if you treated it as real? Because sometimes your intuition knows what your mind hasn't figured out yet. Your body is incredibly wise, and it often whispers before it screams. Rather than thinking, "I'll wait and see," what if you gave yourself permission to act? To say, "I don't feel right, and I'm going to check it out." You might feel silly walking into a clinic with nothing more than a hunch. But what's sillier? Being cautious and walking out safe? Or brushing it off and missing your only warning? When something feels different, don't dismiss it. You know your body better than anyone else ever will. And if something inside you says, "Pay attention," then maybe it's time to listen. Let's be honest. Going to the doctor isn't always convenient. You've got plans, responsibilities, routines. And when symptoms come and go, especially when they're not dramatic, it's tempting to wait. But what if waiting costs you more than time? What if that short-lived headache, that moment of confusion, or that strange numbness is the only chance you get to stop a stroke before it takes something precious? Many people who've had strokes look back and say the same thing. "I didn't think it was serious. I wish I'd gone in sooner." And here's the hard truth. Sometimes even the medical system misses it. We've heard stories. Patients sent home with painkillers, CAT scans that show nothing, emergency rooms too busy to dig deeper. So what can you do? Speak up. Be firm. If something feels wrong, ask for more. Ask for an MRI, not just a basic scan. Ask to see a neurologist. Bring someone with you who can advocate if you can't find the words. You're not being dramatic. You're being proactive. Instead of lying in a hospital bed wondering what went wrong, you could be standing in your doctor's office, stopping the stroke in its tracks. Instead of needing months of therapy, you might just need a few tests and a treatment plan. You have a voice. Use it. Because early action doesn't just save your brain, it saves your life as you know it. So now that you know the signs, what can you actually do to reduce your risk? The good news is, a lot. Stroke isn't always random. In many cases, it's the result of small choices made every day. Choices we can change. Let's start with the basics. Do you know your blood pressure? High blood pressure is the single biggest risk factor for stroke. Yet many people don't feel a thing. It doesn't hurt. It doesn't warn you. But it quietly damages the blood vessels in your brain. Instead of assuming you're fine because you feel okay, check your numbers. At home, at your doctor's office. And if they're too high, manage them. Through medication, yes, but also through movement, nutrition, and stress reduction. How about blood sugar? Diabetes makes your blood vessels sticky and fragile. If your glucose levels aren't under control, you're at greater risk, often without symptoms. So instead of guessing, get tested regularly. Know your A1C. Cholesterol matters too. But here's something many don't realize. It's not just the amount of cholesterol, it's how inflamed your arteries are. Chronic inflammation from poor diet, smoking, or lack of sleep sets the stage for trouble. So what can you do? Try this. Walk for 30 minutes a day, 5 days a week. Eat more foods that come from the ground and fewer that come from boxes. Stay hydrated. Sleep 7 to 8 hours a night. And yes, quit smoking if you still do. It's never too late. Instead of living in fear, live in awareness. Instead of hoping you'll never face a stroke, build a life that lowers the odds. You're not doing this just for today. You're doing it for the years ahead, for the trips you still want to take, the birthdays you want to celebrate, the quiet moments you still want to enjoy. Because prevention isn't a sacrifice. It's a gift to your future self. Let me leave you with this. If you've watched this far, it means you care about your health, your life, maybe someone you love, and maybe, just maybe, you've felt one of these signs before. If so, don't ignore it. Don't wait. Don't wonder. The biggest regret we hear from stroke survivors isn't about the stroke itself. It's that they saw the signs, but said nothing. But now, you know better. So instead of silence, speak up. Instead of, "It's probably nothing," let it be something worth checking. And if this video opened your eyes, imagine what it might do for someone else. Share it. Send it to a friend, a sibling, a neighbor. Because one small action today could save a life tomorrow. Subscribe if you want more health insights made for people like you. Hit that notification bell so you don't miss what's next. And before you go, ask yourself, is there anything at all that's been feeling off lately? Then, do the most powerful thing you can. Listen to it and act.